let's get started into why we are here, why we want to discuss this multimodality. So multimodal data is everywhere. Yeah. So if you think of human have multiple sensors as well. We have 5 sensory input and a lot of common sense as well. So when we are making decision, we make use of all those modalities which are coming in. Yeah, and we seamlessly do that without even sometimes realizing it. So same is true for the machines. The multimodal data is everywhere. If a patient goes to a hospital, so they take multiple measurements for that patient. They take blood samples. They look at the history, and so on and so forth. And they may take some medical images as well. And what you want is to do the diagnosis or prognosis of that person based on all the information you have. And you have to somehow combine those information using AI and machine learning models. And then you may, or not you, doctor, specialist, because these models are there to help the specialist to do things faster. Essentially, it's not there to replace any of the doctors and medical professionals. So then those medical doctors can ask particular questions, or even normal human can ask multiple questions that what is shown in these images, for example, and then the AI model will be able to tell that what it thinks is there in the images, and it can segment the tumors and so on and so forth. Okay, so that is a lot of application in the healthcare. Also, in the case of cancer, it is quite critical to design the treatment for the patients very carefully. So for that, you need to predict what type of cancer it is from the genomic data, so genomic sequence of the patient and cancer, as well as from the histopathology microscopic image of the tumor which is taken out. And that is critical in determining at which stage the cancer is and what is the survival chances of the patient. So this is some of the work which is coming from our group. So it's under review. So you have large, massive images, like 150,000 by 150,000 pixels. And you have the genomic sequence corresponding to that. So you build a multimodal AI system which basically integrate this histopathology and genomic information and tell you better prediction of cancer subtype and survival and so on and so forth, which is very critical for designing the treatment for the patient. Okay, so there are other nice works coming from tech giants as well. So one, as an example, I am presenting CogVLM paper from last year. So basically, you have this kind of multimodal model. So this is vision and LLM integration. So they have very broad knowledge. So they understand the factual knowledge about the places. So you can give a picture and ask that where this photo is taken. It would understand. You can ask the model. You can interact and chat with the model. I'm sure that all of you have used some kind of generative AI system or multimodal system where you pass images or any other things, and you can question about that images. So you can ask, for example, how many houses are there. You can ask factual knowledge about the people, so it understands famous celebrities. You can ask basic arithmetic questions. There are 2 apples plus 1 apple, so it should be 3 apples. So these are very, very advanced models that people are doing a lot of interesting stuff. You can do grounding as well. For example, you can ask a specific question that what are the clothes, color of the clothes of the girl. There are 2 girls who is holding flower. So now you can ask the vision language model to go step by step and provide you the reasoning and grounding and so on and so forth, and it will be able to do that. So it will understand that there are 2 girls. It will identify the girl which is holding the flower, then it will identify the clothes of that girl, and it will tell you the answer with a bounding box. So these are very advanced and sophisticated model, and the good thing is that many of them are open source. So you can use CogVLM. This is open source as well, and there are many other open source models which are even stronger